Yeah, okay. Good morning, students. This topic is slightly different from what you are. The door close, kar sir. Door. This topic is slightly different from what we have been doing last, say, about 3 years. We are dealing with the patient's pathology, but now with the advances into biomedical engineering, the way we operate have changed. The results have changed, the severity has changed, and the magnitude of surgery has also changed, and the all credit goes to what is called as energy sources. In long back, energy sources were highly limited. Now they are finding out new and new energy sources and devices. So these devices had totally changed the face of surgery. Right from laparoscopy, right to up to the robotic surgery. Notes. All these things are possible only because of advancement in energy sources. So we have to consider this in detail. Why we should consider as a doctor? Because we are the one who is going to use these biomedical wonders. It is not the technician or it is not the engineer who will use it, it is you. And once you start using the instrument, you must have a requisite knowledge of its advantages, shortcomings, and complications. You can't run away from understanding what actually you are doing because there are a lot many complications which can occur due to inadequate knowledge and insufficient process, and misuse also does occur. So we'll consider that into detail. To start with, what is it? It is an energy. What we are doing, we are converting an energy source into a heat source, vibration source into electrical source, radioactive source into energy source. So these are the different types of sources and devices where actual machine is called a device and it is a source. This type first concept was long back when it was a first electrosurgical device which was invented, and the credit goes to William T. Bowie. Remember, all electrosurgical devices, that means all cauteries are called as Bowie's cauteries. Remember the name Bowie cautery. And this thing was first used in 1926 by nothing more than the great surgeon Harvey Cushing. The surgery done was removal of a mass from patient's head. You will always remember Cushing throughout your career, mostly related to so many syndromes and mainly related to neurological and brain pathology. Harvey Cushing. He used this first in 1926. What has happened afterwards? For a long time, for a very long time, it was electricity was the only source of energy, and it is called as a short wave diathermy. Why short wave? Because it is restricted to particular part, and then also it has proved most valuable and versatile aid to the surgical techniques. The techniques have totally changed with this. Now many times you see newer surgeons, super specialty operating without a blade. They are taking incision directly with the diathermy over the skin. Now it has become proper. Initially we never thought that we can touch the skin with the diathermy, but now it is routine. And for a hemostasis, now nobody is applying artery forces and tying the bleeder, except it is more than 7 millimeters. Very large vessels are tied or rest are coagulated. So this electrocautery has got a cutting effect and coagulation effect. So this is the boon. But what happened afterwards? This machine has got a more thermal spread. Thermal spread is a characteristic of whenever you touch any object, mainly a biological object, and that is proving to be a disadvantage during surgeries due to thermal spread more than expected. So what has happened? Though we are using this monopolar bipolar in laparoscopic surgery, but there are limitations. So in view of new surgeries like directly operating our brain, robotic surgeries, we need something more than electrocautery. Moreover, many accidents have occurred due to inadequate or improper use of a cautery machine. The reason is imperfect knowledge or some negligence on part of a mainly doctor, surgeon or assistant. So this has made that the modern gadgets has to come. This has led to invention of most advanced and modern surgical energy devices. Surgical energy source and energy device. Device is a modem. Source is a source. Okay. So this is the in short what has happened. And that has led to what it is ESU. ESU is called as Bowie's machine. This ESU mainly uses electrical energy as source, and this source is passed in form of high frequency electric current through a biological tissues by giving cutting, coagulation and desiccation, that means total absorption. But against the only electrical source, new generation sources are using primarily compressed bipolar energy, ultrasonic waves energy, laser energy, radio frequency sound wave RF, cryosurgery and hydrojet energy surgery. So these are the different sources which has come in place of electrical energy source. But remember, electrical energy is the most cheapest, easily available and is of a universal use. What is the difference between an advanced energy source? Advanced energy source uses higher currents, more current, less voltage and less thermal spread. So these are the aims of using advanced energy sources. So what are the sources? First source as usual it is electrical energy. Then comes argon beam laser, which laser was first used for skin, argon beam. Then came gas laser, that is CO2 laser. Many lasers are there. Ligashure. They have developed a compressed bipolar that is called as a Ligashure vessel sealing system, LVSS. LVSS is a Ligashure. Biggest advancement, ultrasonic harmonic scalpel. This is a boon to surgical side. Most commonly, most advanced technique we are using till today. Then came combination of all these systems. Combinations of cutting, coagulative and desiccation. That means fulguration. Everything together without changing an instrument. That system is called as Thunderbeat system. After that came radio frequency ablation, RFA. New technique for a large mass, it is CUSA. CUSA is cavitated technique where you aspirate. Cryotherapy. Cryo is cooling. Cooling surgery, cooling temperature, ice use for cryotherapy. Then Enseal RF system where you are directly sealing the system. It is called as Enseal radio frequency system. Hydrojet device where the pressure of water is used to break the tumor. Microwave ablation. Again, waves are used to ablate the tumor. That is tumor ablation. This is mainly used for palliative surgery. And ultrasound dissector. By using ultrasound waves, you have to dissect the tumor. Okay. So these are the newer energy sources. So what are the principles? What has happened? Monopolar diathermy still plays a major role even in laparoscopic surgery. But there are definite risks. Surgeons are already using advanced energy devices for a dissection to seal and remember divide and cauterize blood vessels up to 7 millimeter diameter. This is the highest diameter you can seal by indirectly, that means by advanced energy system. If it is more than that, you have to go for ligation with the whatever material, whether you use Vicryl, whether you are using PDS, but you have to lag it. Up to 7 millimeters, the instruments are capable of making the dissection and division seal. That makes us to what are the devices? Mainly three types of advanced energy devices are available. Commonest is bipolar electrosurgery. Bipolar electrosurgery, that goes to what is called as a vessel sealer. Then comes the harmonic scalpel and combination of a harmonic plus energy, different combinations are avoided. And above all is, one must remember the word laser. For laser, everything is different, the energy source is different, instrument is different. So we'll consider that separately. That is a combination. So to remember, energy source of a new generation. Advantages: higher current, less voltage, less thermal plate spread, plug and play. That means everything fixed. You don't have to change the output and power. Output and power is preset. Impedance feedback and adjustment. This is very important. If you understand, if the machine themselves understand that we are giving more current, so it will automatically reduce the current given to a tissue. These devices can grasp, dissect, coagulate, transact, and all this with a single instrument. This saves lot of time, lot of energy, and the risk for frequent change of hand instruments. Cost is more. Why? Because many of the instruments, hand instruments, are disposable, but that makes them more safe and more effective. Okay, so this is the principle of advanced energy source. We will go to basics. What we are commonly using is ESU. It is called as electrosurgical unit. Again, the name of Bowie. Bowie name always remains with us. What it does? This ESU will pass high frequency electric current. High frequency electric current through biologic tissues. Here we are doing in vivo. Practically we are working. And on whom you are working? It is a human body. So electrical current is passed through human body, who is our patient. Understand? If a electric current passes through our body, we will get convulsions. In high frequency, patient may die. So, but we are using it under a specified conditions, and our aim is to achieve a specific surgical effects such as cutting, coagulation, and desiccation. How do you do it? By converting the electrical energy into a heat energy. This is the principle. There are two types. Cutting. Cutting is achieved primarily with continuous sinusoidal waveform. Energy is in two forms. Continuous sinusoidal waveform for cutting. Cutting primarily done by monopolar. Whereas coagulation. Coagulation is achieved by series. That means interrupted energy of the same sinusoidal wave packets. So it is in interrupted energy. For cutting it is continuous energy. Understand the difference between cutting and coagulation. So surgeon has to select this waveform requiring on his uses what exactly he wants to do. And the principle is same. So whenever, remember, whenever an electric current passes through a conductor, this conductor can be water, conductor can be air. In our case, it is a human body. Whenever the electric current is passing through our body, some of its energy, not all, some of energy appears as a heat. And we are making the use of that heat for our coagulation, cutting or desiccation purpose. Remember, the electrical energy is converted into heat energy for all electrosurgical unit. That is the work. Diathermy machine work is to convert electrical energy into heat energy. So sources, diathermy, it is a machine which converts electrical energy into heat energy. This must remember by heart. So what is it? How the heat is produced, and it depends on what? These are the basic things for electricity. But we have to remember, it depends on the current waveform. That means which type of wave we are using, intensity, how much the power is given, equally important, through which type of tissue electrical set is traversing. That means what are the properties of a tissue. And most important for us is the size of electrodes. Always remember there are two electrodes. One is entry, one is exit. So what is the difference between their size? That matters most in case of monopolar energy source. So what we are dealing commonly is two types of a diathermy machine, and broadly they are called as monopolar and bipolar. Monopolar means acting over through a single probe, bipolar acting from two poles. In monopolar, alternating current is produced by generator and passed via electrode to a very small surface area. This is important, I will discuss in detail. Here, the current then passes through the tissue, entering from a small area and going to a passive electrode, because all the electricity has to go to earth, and that is earth pole, that is a return pad. And this surface area of contact of active electrode is small in comparison to passive electrode. There is a huge gap from 1 point to 100 times. So what happens here? Advantage, the concentrated powerful current will produce heat only at an operative site. Understand? From one small point it will enter, heat is produced, and rest of the electricity is diverted to the ground through a passive electrode. This is for monopolar. What happening here? It is a cutting. Cutting is happening with the sufficient heat applied at the tissue. What it causes? It causes cell water to explode into steam. First steam is produced, they don't boil. Here the cutting current is a continuous waveform. For that, monopolar diathermy is a continuous waveform. Always remember. Coagulation as against intermittent sinusoidal waveform. The third is fulguration. Fulguration is mainly used in superficial structures or in liver. What we are doing here? We are not directly touching the object, but we are making a large sparks to jump through the air gap. So here the medium is air. We are not directly touching. It is through air, a large quantity of electricity goes and it will fulgurate the tissues. This fulguration can continue up to charring of the tissue occurs. So mainly used for skin as well as intensity. This fulguration, now fulguration is taking two things. It is called as a blended current. Fulguration is called as a blended current. Remember, monopolar, bipolar and fulguration, that is blended. Three types of electrical sources we are using. Now bipolar. In bipolar, there is basically change. There are two modes. Two electrodes we are operating. So what will happen here? The current flows only through the tissue which is held between two forceps of electrodes. In monopolar, it will enter at one point, go through the passive electrode. Here, it is the tissue which will be held between two forceps, and there only the tissue will be, or energy will be concentrated, and it will go back through the same into machine. So there is no passive electrode. In bipolar, it is a single instrument. In monopolar, we can use cutting and coagulation. Both the modes are available with monopolar. As against, bipolar is primarily used for coagulation only. It is not going to cut. You hold the tissues, coagulate, get up. So in principle, what is electrosurgery? It is based on the principle of a rapid heating of the tissue. What is this heating we mean? This is simple electricity. Everybody must be knowing. Remember, sudden temperature rise from normal body temperature. Normal body temperature is roughly 38 degrees to 45 degrees within few seconds. Very sharp. But that process up to 45 degrees is a reversible process. Remember, it is a reversible process. So that minimum below 45 has no tissue breakdown or tissue coagulation. Now what happens? Above 45 degrees. Above 45, irreversible changes take place. And what are they? They are going to inhibit the normal cell function, leading to cell death. Above 45 degrees to 60 degrees, it is a cell death and denaturation of protein and solidification of a substance which remembers to hard boiled egg. Normal tissue is looking like a boiled egg, and that is termed as a coagulation. Coagulation occurs between 45 to 60 degrees centigrade, and it is accompanied by a tissue blanching. That means there will be no blood supply to that. So coagulation is like a hard boiled egg, and it is tissue blanching. Temperature 45 degrees to 60 degrees centigrade. Now for all purposes, you must have seen OT, that surgeon holds a blue colored pencil. A blue colored instrument is held in hand where it has got two switches, usually two switches. One is yellow, another is blue. Because the way you are holding the instrument is like holding a pencil in hand, this instrument is called as an electrical pencil. This pencil has got a switch. Yellow is for cutting and blue is for coagulation. Blue is for coagulation, yellow is for cutting. So this is how it is specifically decided. In all these cases, this electrosurgical process appears at the tip. Very important. It appears usually at the tip, mainly for endoscope and laparoscope. In our case, in open surgery, the whole tip, that means on the side of it also, has got a current. So you are not supposed to touch anything with the side, you must touch with the tip. Otherwise, more problems will occur. So this dispersive electrode to return high frequency current to the electrosurgical unit without causing harm to the patient. Only point you have to use, and rest of the electricity which is left after producing heat goes back to the electrosurgical unit, and it does not cause harm to the patient. And that is mainly large passive electrode. So what are the basic forms of energy source? You just remember it, okay? Energy source is started from 3000 BC. That doesn't mean that electricity was invented. That doesn't mean electricity was invented in 3000 BC. But what they were doing, even if you find now, if you drill it, that means if you rapidly rub away certain instrument on both sides, there is always a heat produced. Even the heat is produced for small purposes by rapid turning of two stones, and this stone were afterward used as a cautery to control the bleeding. That means you have to make it hot. Any hot object is going to act as a cautery. That is why we are using heat through electricity to cause a coagulation. There are different electrosurgery. It is radio frequency alternating current to vaporize coagulated tissue. What does the cautery mean? Cautery itself is a hot iron. So hot iron and electricity is equal for us. Bowie developed low cost Parker, so all electrocauteries are called as Bowie cauteries. There are three types of power setting. In low power, usually for skin, less than 30 watt for cutting, more than 30 watt for coagulation. Medium 30 to 150 for cutting, 30 to 70 for coagulation. Remember, cutting needs more current than coagulation. This goes without saying. Understand? In high power, more than 150 watt for cutting, less than 70 watt for coagulation. Simply remember, cutting requires more current than coagulation. Okay. So this is all I am trying to tell you what exactly we are doing. You must be aware the moment you are holding a pencil, because it is very common use now. Everybody must know the uses of cautery and its principles also. Without that, you cannot prevent the complications. The basic rule of electricity is applied here also. What the rule says? Electrical current flows into the path of low or least resistance, and electricity always seeks to return to ground. That means from a positive to negative pole. This is the basic of electricity. Current means amperes, voltage means volts. How does the tissue damage occur? 50 to 80 degrees, tissue coagulation. 100 degrees centigrade, desiccation and vaporization. Carbonization of the tissues, 200 to 300 degrees. Remember how much temperature we are getting. In some cases, we have to heat up to 1000 degrees centigrade. And this amount of heat generation depends on amount of tissue in contact and what type of electrodes you are using. So short duration, high voltage is a coagulation. Low voltage, high wattage, continuous is tissue cutting. High voltage, short duration, coagulation. Low voltage, long duration, tissue cutting. Okay, this is in short. So we have considered two types of electrical source. First is monopolar, another is bipolar. We will discuss both. Again, in monopolar, continuous sinusoidal waveforms will cut the tissue with very little hemostasis. Remember, whenever you cut, hemostasis achieved is less. So don't rely on cutting for hemostasis, because it is called as pure cut. Continuous sinusoidal is a pure cut, not a blended cut. In blended cut, you get cutting as well as carbonization. What happens here? During every positive and negative swing, a new discharge is formed and it will disappear at the same place. That is why the concentration is only at one place, and sudden increase in temperature due to resistive heating. Against that, bipolar. Here, the bipolar mode concentrates the current between two electrodes. They are forceps we are holding like a handpiece. Because of a less distance, they require less power for achieving the same coagulation effect than the monopolar. Monopolar has got cutting as well as coagulating. Coagulation needs more power. Against that, in bipolar, it is the minimum power as compared to monopolar. That is why monopolar mode is not preferred for coagulation. It is a bipolar mode which is preferred for coagulation. Always remember. Monopolar for primarily cutting, bipolar primarily for coagulation. Understand this basic principle. So, how is the monopolar diathermy looks? Everybody must have seen OT. This electric energy is, if you can see here carefully, is passing between via diathermy probe and returning to machine via the patient earth plate, that is called as foot pad. You can see the black color is the first. This is a monopolar diathermy unit. This has got main problem. It cannot work with the pacemaker containing patients, and most common complication is diathermy burns. Hence, and very important, we will consider in detail afterwards, monopolar diathermy should not be used in circumcision and near nerves. If you see in the last picture, this red color tip is where high current concentration is achieved. High current concentration density is achieved at a single point where your pencil is acting, and that whole current is taken by this blue colored pad to the machine itself. So this is the grounding pad. This is the current density is highest at only one point, that is the entry point. This is the difference, very important difference, please remember. These are the commonly used accessories in our OT. It is a foot pad. One is for the coagulation, one for the cutting. Two are separate. This is a monopolar cautery pencil. And last one is a large area of grounding pad. So large area for current reception is here on the right side. Okay, you understand this? So what are the advantages of monopolar? In short, monopolar are very easy to use. They can be used for the dissection. They have got a greater tissue penetration, and area of coagulation is more than bipolar. This is not always wanted, but coagulation in a larger area can be achieved by monopolar as compared to bipolar. Disadvantages: larger volume of tissue is injured, it can interfere with pacemakers, and it definitely requires a distant return electrode. So these are the advantages and disadvantages. As against bipolar, this bipolar does not need an earth plate. If you see this figure, there is no earth plate, only two branches of a forceps, like a tooth forceps, and the current is going back to the diathermy unit. Through single cable, current is coming, again going back. Here you can see how the coagulation, it is very distant, only one object is touching, that is our probe, our forceps is touching the desired part in case of a bipolar coagulation. Advantages: it needs minimal thermal energy. It can work with pacemaker. It has got comparative less risk of coupling injuries, capacitive coupling injuries. We'll discuss them afterwards. And most important, this bipolar can work in saline. This is important for a TURP, TURP surgery. For a prosthetic surgery, you can work with bipolar in saline. Against that, disadvantages: the bipolar use requires more skill and repetitive practice. This mode is only for coagulation, and bipolar has no dissection capabilities. On right side, this is a bipolar machine where you can see different types of forceps. Practically, most of the machines now has got a monopolar and bipolar together. Okay. So what are the complications? Why this diathermy is everything is so good? Why it has gone into backstage? Rather for advanced surgeries only. Complications. Most important complication which used to occur in the past is electrocution. That means the energy going directly and causing death of patient. That is electrocution. You must be seeing in paper or TV that the major current passes through the patient or human being whenever they are standing below a tree during a rainy season, where the whole current goes through their body to the ground and people are dead. It is such a high current. Same thing can happen here. But now the machines are well manufactured, high precision, so that electrocution risk has minimized. Okay. Second is explosion. Why does explosion occurs? Because there is always a spark. Whenever you go for cutting or coagulation in monopolar, there is a spark, and that spark can infiltrate the volatile or inflammable gas available in OT. All alcohol-based skin preparation, they are commonly used for skin preparation. Explosive gases associated, oxygen is there. Many times O2 is already there. So there also there is a risk. And the naturally occurring gases, like if you are operating over the colon, do not use monopolar because that gas itself is inflammable. So explosion, electrocution and burns. This burn is most commonest of all diathermy accidents. Either it is an open or an endoscopic surgery. Why this occurs? Because it is a faulty application of different electrodes with inadequate contact area. So what we have to do? Here you have to see that patient is not earthed anywhere by metal object apart from the reception pad, that is a large pad. You patient should not touch any metal objects on our operating table. Like bars also, even leg bar also, leg should be protected by what? By cotton. So this is a precaution to take for birds. Another insulation problem. Inadvertently, what happens sometimes without intention, the cautery is lying there and foot pedal is activated. This is unfortunate part, but it does happen. That is why there is a principle. Always remember, cautery machine and foot pad must be operated by same person. So this inadvertent activity will not occur. Another complication is what is called as channeling. This channeling has got a very important role, particularly in monopolar. What is it? Whenever this current goes up to the large foot pad by a narrow channel, that means our pedicle, whenever it is going through narrow channel, there will be more heat generated within this channel. This heat, before going to the negative pad or a ground pad, there will be heat generated in the small channel. What it will do? Again, it will coagulate the tissues in its own way. Accidentally. Our purpose is not so. But what happens? This can prove disastrous. Always remember, monopolar cautery should not be used in circumcision in child. Because if you use that, the power has to go back, electric current has to go back to the foot pad and it has to channel through penis, through the corpora. That is why there can be burning of a penis. Remember, never take the risk. Monopolar, never for circumcision. Also, it should not be applied to testes because here also from testes it is going through a narrow channel of a spermatic cord. So spermatic cord can burn if you use monopolar in testes. So two conditions where they are contraindicated is circumcision and surgery of testes. Monopolar should never be used. If you need some cautery for that, it is bipolar diathermy should be used. Okay. So monopolar or even you have to be very careful with pacemakers. Again in laparoscopic surgery, wrong structure touching, capacitance burning, there are many complications. But with the advances of instrument and rapid constant use by laparoscopic surgeon, these complications are rarely occurring nowadays. So what are the complications? Whenever you touch intraperitoneal structure with a diathermy with another metal instrument, here what is happening? Coupling occurring indirectly. Direct coupling rather. You are touching another metal instrument. That metal instrument will touch a soft tissue like intestine and that will be indirectly burned. It is a major complication. So your diathermy should never touch to any unwanted object. You must touch where you are exactly want to touch. And whenever not in use, the bipolar or monopolar forceps should be taken out of abdomen and kept aside. Use only when you need, bring it inside, otherwise outside. So there is also one condition. Capacitance coupling. What is here? It happens unintentionally. This is a fault of insulation. So to prevent this insulation, metal ports should never have plastic cuff. As against, if you see recently, all the ports are made entirely of plastic. Understand? If they are of plastic, this chance of capacitance coupling does not occur. So that what major problem here is you don't know that you have burned intestine. After 2 to 3 days, you come to realize that patient has got perforation. He is going in shock, septicemia. Why? Then you realize that something has been touched. So that complication must be avoided in any case. It must not happen in a laparoscopy. Understand? So there are two types of coupling, direct and indirect. We have considered both. So what you have to remember? Monopolar, bipolar cautery are commonest device used for hemostasis. How they are used? Tissue dehydration, vessel thrombosis or tissue disintegration. And monopolar cautery should be avoided in cardiac pacemaker patient, on testes, cord or during circumcision. You must write down, never use this. Okay. At the same time, do not use spirit near the cautery spark. Again, it will cause burn. Understand? So with all these complications or accidents, there is a need for advanced bipolar electrosurgery or alternate energy devices. Something more has to be used for. Because what has happened now, you are using it very fine, but you cannot obliterate a larger vessel. You cannot operate at a depth. Understand? So for that, you are needing a different type of instrument and different types of energy sources. Monopolar has got usual use in our superficial structures. Sometimes in laparoscopy for ligating or coagulating the vessel, like appendix vessel, or sometimes for ligating the or cauterizing a cystic artery. More above you go, this bipolar tissue system is advanced, which is called as a vessel sealing system. So you are going one step ahead. The difference is it actually fuses the vessel wall to create a permanent seal, and it is a wide use. Combination of energy devices have occurred, number of them. So technology has evolved with respect to both harmonic and bipolar advanced energy devices. These two have rapidly taken over by storm. There is a product known as Thunderbit by Olympus. It is very costly, but it has combined both modalities of cutting, coagulation, and up to 7 millimeter of vessel of the use of harmonic as well as electrical in a single device. Here we do not have to change the instrument. A single instrument will do all the functions. And there is also sometimes seal only mode, seal only, no cutting is available on the Thunderbit. This is only for your remembrance. Thunderbit uses combined both modalities in a single device. So criteria of efficiency, how you are judging the energy system, which one is better? For all energy systems, these are the criteria. Number one is visibility. Visibility, remember, visibility is not that you can see or not, but with the help of heat, there is associated fumes which are created. And these fumes will restrict your visibility of a structure. Understand? This is meant by visibility. Second is how much time it has taken, how sharp it is. Less the operation time, more is efficiency. And next is thermal spread. Whenever you touch a tissue, the spread should be minimum, or spread should be how much you desire, not more than that or less than that. That is called as a thermal spread. And burst pressure. What is this burst pressure? At what level of electrical or harmonic current the cell will burst. Ultimate aim is the bursting of the cell. Okay. So these are the four criteria. And Thunderbit maintain all. This is a comparison. In Thunderbit, the visibility is unimpaired, not lost. It is fastest in cutting. It has got highest mean burst pressure and minimum or least lateral thermal spread. We are operating through the tip, but some energy is bound to go beyond that laterally. So this lateral spread is minimum in Thunderbit. Commonly used system LVSS, LigaSure Vessel Sealing System. What happens here? Because of a high current, there is a smoke production. If you are seeing a laparoscopy, you can see that there is a smoke prepared and you have to absorb it. It takes some time. You have to stop doing surgery. So in this LigaSure, there is more smoke produced, comparatively slow, and it has got comparatively more lateral spread, lateral thermal spread, that is 2 millimeter. Harmonic scalpel, which is a gem of today, but there is a mist production. Mist production will create harboring the visibility. Harmonic scalpel is a slow to act. It is a slower surgery. It has got lowest mean burst pressure. That is one of the positive side. And lateral spread is only 1 millimeter. So this is one of the best instrument available for today. So considering one by one. This LigaSure Vessel Sealing System. This system is basically a bipolar vessel coagulator. It has got a unique property of active tissue response feedback. That means what type of tissue is there between your forceps, the feedback is given to the machine and machine itself divides or decides how much energy has to be delivered. And when it is complete, the machine automatically discontinues. This is when the seal cycle is complete. This is a major advantage. There is a sound produced. The moment sound stops, that particular action or controlling as complete. This is what important. We don't have to think whether the seal is complete or not. This guesswork is avoided. There is some amount of sticking, but there is a lateral thermospread, but charring is minimum. This machine involves the same technology of monopolar, but the use is different. What it is using? It is using patient's collagen and elastin to seal and divide. Collagen is always important for sealing. Elastin is a part of it. So, body's own parts or mechanism is used to form a seal. This is the importance of a vessel sealer system. And most important, automatic discontinuation when the seal is complete. Below that, in red color I have given, LigaSure can seal vessels up to 7 mm diameter. This is an ideal for coagulation. Average time of sealing is minimum, that is 2 to 4 seconds. LigaSure can seal blood vessels, lymphatics, pedicles and tissues. Here, that risk of is not there. Like a current going through penis or vas, it is not there. And the seal which LigaSure is producing in an artery can withstand 3 times of normal systolic blood pressure. That means this seal is so strong to withstand 3 times. That means up to 400 millimeters of blood pressure, which is never taken, very, very rare. Even that high blood pressure, this seal will not dislodge. So this is the advantage of a LigaSure system. So this generator detects by the jaw what type of tissue is there and how much the pressure is required. This LigaSure system is called as a brand name as a Valilab. This is a Covidon. Valilab is a brand name for LigaSure, and it is an apparatus for sealing vascular tissue. Company is Covidon. It is the sealing due to high current and low voltage. Remember, all this is high current, low voltage for modern devices. The current goes up to 180 watts. In comparison to cryosurgery, electrosurgery, it is very high. See here, in some cases, high coaptive pressure during generation of tissue temperature can go up to 1000 degrees centigrade. 1000 is a very large thing where hydrogen crossings are ruptured and renatured. So this melted collagen forms a permanent plastic vessel seal even into vessels ranging up to diameter of 7 millimeter. So this is how the vessel sealer acts. Next comes the most important system of today is a harmonic scalpel system. This harmonic scalpel is a high power system which works at a frequency of vibration from 55,500 vibrations per second. Just imagine the speed, at what speed it is vibrating. So it is called as harmonic. Harmony is maintained. Harmonic scalpel is an instrument that uses ultrasound technology to cut tissues while simultaneously sealing them. This is very important for harmonic scalpel. It cuts and it also coagulates. In same instrument. Same instrument is doing both functions. That is the beauty of a harmonic scalpel. It is very costly, around about 12 to 14 lakhs. The machine which is dissecting the tissue by ultrasonic waves is called as ultracision. Ultracision is the name of machine. Then the generator, what is doing? It is converting ultrasonic energy into a mechanical energy. In our old instruments, it is electrical energy which was converted into heat energy. Here, ultrasonic energy is converted into mechanical energy. This is the energy system is different. So, harmonic scalpel blades uses high frequency mechanical vibrator to simultaneously cut and coagulate. Minimal thermal spread, safety of dissection near vital structures. Most reliable and divide and ligates vessel up to 2 millimeters, and also lymphatics. So the size comparatively here it is less strong. 2 millimeter can be sealed. It is most versatile, cuts, coagulates and dissects without instrument exchange. This mainly reduces the time of surgery. One instrument is doing all the function. So benefits is effective hemostasis by sealing vessels, tissues by means of protein denaturation caused by vibration rather than heat. It is a tissue protein denaturation. Ultrasound is used instead of electrical current. The common uses now are all open lap surgeries, most preferred for tonsillectomy, in all OB/GYN surgeries, endoscopic surgery, thyroid, lung biopsy, hemorrhoid, cope or gallbladder. The advantage is minimum bleeding, less recovery time. There is nil or minimum lateral damage. Lateral thermal damage is not there because the thermal energy is not used. And in fact, there is a minimum temperature. Minimum temperature there is, and there is minimum smoke. Smoking is minimum. That is why the field is comparatively clear. For shortcomings, considering the cost, the main competitor for harmonic scalpel is old our Bowie machines. They are maybe 80,000, 1 lakh, 2 lakhs, and this is 40 lakhs. It takes more time to coagulate and cut. Time required for harmonic is comparatively more. Another, it can have both actions at the same time. It can only coagulate when it is cutting. As against our cutting with Bowie are independent. Cutting is different, coagulation different. And so it is called, all ultrasound energy is called as harmonic scalpel. In conclusion, it is a precise dissection, a reliable hemostasis, less lateral scarring. And ultrasecon is the name. And here is the instrument where everything is happening at the tip. This is an ultrasecon guide. So this is the details how they are looking like. Refined blade design is there. Advanced hemostatic mode. And remember, this can seal up to 7 millimeter diameter with the help of harmonic scalpel. Now the advanced system has come. You can read to it that coagulation of vessels up to and including 7 millimeter diameter with the use of advanced hemostasis hand control button. This is the latest addition to harmonic scalpel where a button is there, separate green button which will ligate or coagulate vessel up to 7 millimeter. It is same like what you have seen in vessel sealing system. And its system adapts, how it adapts, how much activation time is required. It decides first and then gives a current according to that. So there is no extra current or risk is minimized with the help of ultrasecon. The most important part here, where there is always a short note asked these days, are the energy sources of lasers. Everybody must be able to write down something on lasers. So laser is an important energy source. What do you mean by laser? Everybody knows. LASER, laser. It means light amplification by a stimulated emission of radiation. This laser is nothing but changing the course of light rays. This was initially thought or invented as a ruby laser in 1960 by Theodore Maiman. Common use done by Ali Jawan in 60 same time. But first invented optical laser, that means for use in surgery, in 58 to 77, and it is commonly used now after 1990. Laser is a mainstay of any surgery. For all practical purposes, laser is the best way of operating without a drop of blood and more important, OPD procedure. Laser, light amplification by stimulated emission of radiation. The principle is coherence, monochromicity and collimation. These are the three principles. Because laser lights differ from regular light. A regular light has different, it is coherence. Coherence means all they are concentrated at a single place. They are concentrated at one common point. There is a single wavelength, not different wavelengths. And collimation is all light waves run in parallel in a single beam. Because of a single beam, the energy, electrical energy, again, the source of energy is electrical energy. What we are doing now, electric energy is converted into laser. In our old system, electric energy is converted to heat. Here it is a laser light output. Again, it has got two modes. One is a continuous mode, another is pulse mode. Continuous mode is watts, pulse mode is joules. And more important, the output depends on medium of light through which the laser is traversing, whether it is traversing through blood, water, wherever it is traversing, or through muscles. So again, like electric, continuous and pulse mode. Remember, this is a laser output from an electrical source. This figure shows the routine light where the light is directed in all activities. But the laser light, it is a collimated beam. You can see here, it is going straight line. They are not changing their course till they hit their object. Effects, whenever they get impinged tissue, reflected, absorbed, scattered or transmitted. These are four things can occur. Now what happens? It is an absorption. How much they are absorbed? And that depends whether the medium is a blood or water. We are talking of a human being. Light of specific wavelength are absorbed by hemoglobin. And here the color is blue-green. Whenever they are absorbed by water or vaporized to steam, the light is infrared light of a CO2 laser. You must have heard the name infrared light. So there is a minimum charring and minimum damage to surrounding. Again, the effect of laser depends on total energy, wavelength and target tissue. This controls by boiling or protein denaturation. So effect of laser you can see is the depth, the different types of laser. Tissue factors are absorption, scattering, thermal conductivity, local circulation. On these local factor laser factors, power density upon depth, more the depth by 5 mm is Nd:YAG, CO2 1 or 2 mm. Excimer laser are acting only on the superficial. So these two types, remember this is a beautiful photograph. Nd:YAG laser, highest depth, CO2 laser, minimum depth, and excimer are superficial. So these are the differences, the depth of the permutation of a laser. Primarily used for general surgery are carbon dioxide, Nd:YAG, argon, aluminium, holmium, dye laser, pulse dye laser, excimer laser, helium. All many advances are coming up. Okay. So common is this. Nd:YAG laser, most widely used in medical field. High penetration of 5 mm. Endoscopic laser is commonly used for bleeding GI, that means esophageal varices, debulking surgeries. Most common use of laser these days is hemorrhoidectomy. Laser hemorrhoidectomy is preferred by patient because it is OPD procedure and there is no pain. Like scalpel, it precisely cuts through pile mass, melt them and subsequent sloughing. This is Nd:YAG laser for piles. In neurosurgery, Nd:YAG laser is very commonly used for AV malformation, vascular meningiomas whenever there is height, and lesions at inoperable site like midbrain, base of skull, and third or fourth ventricle. So laser has changed the dimensions of the surgery. Laparoscopic surgery, we use CO2 laser. For skin, argon or CO2 laser. For vascular, it is a laser mainly used for laser angioplasty. And most important use of laser is AVLA. In gynec, for endometrial ablation, precancerous region of cervix. And for BPH, that means benign prostatic hypertrophy, the most important is photovaporization. This is commonly used. It has got no bleeding, nothing. Here, the prostate is melted and vaporized. What happens? Instantaneous debulking of a prostatic tissue. And here, the green light is commonly used for its vaporization effect of prostate. Green light. Green light goes through air, the water. No bleeding or less bleeding, and immediate fluid absorption than standard TURP. Fluid absorption is a major drawback for TURP. Large amount of fluid is required and it can be reabsorbed, giving rise to different problems. That problem is not there. Less bleeding, less fluid absorption for laser in BPH, called as photovaporization. Another terminology is LAVA. LAVA is laser assisted vascular anastomosis. EVLA. EVLA is commonly asked. It is endovascular vessel laser ablation. EVLA is very commonly used now for varicose vein ablation. Advantages: precision, bloodless, small or no incision, fast recovery, minimum pain, no or local anesthesia, no infection rate. It is a OPD procedure. It is a OPD procedure. There are certain disadvantages because laser being unnatural, there can be contamination. The laser plum are formed, and unfortunately, constant use of laser plum can lead to malignancy. It is not proven, but it is thought. More important is if you take it near the eye, it is a corneal or retinal damage, and cataract formation is more common. Bronchiolitis is there, and inflammation of a respiratory. So what are the applications are simple. Continuous wave laser, pulse laser, solid state laser, gas laser, CO2 laser, argon laser. So these are all different types of varieties of laser. Dye laser, semiconductor laser, excimer dimer. Excited dimer is excimer laser. They are mainly used with the help of krypton and xenon, and they are called as a dye lasers. Semiconductor laser, again excimer, argon laser, and photodynamic therapy is also possible. This is important. Remember this. Usage in surgery. In gastroenterology, piles, debulking of the luminal malignancies operating through the lumen. Esophagus, rectum malignancy is lower, can be debulked with the laser. Equally important in case of carcinoma of a bladder. In bladder carcinoma low grade, laser is a treatment of choice. Retinopathy, laser coagulation, retinal detachment, and in glaucoma. Glaucoma also very good use. Most important commonest use for laser is a LASIK surgery. Everybody is aware of that. In case of children of myopia, this LASIK gives a future wonders for them where there is no glasses required. What is done? It is a microkeratome which reshapes the cornea. ENT, removal of small lesions. In skin, all tattoos removed, excision of small lesions, and in vascular, it is a laser angioplasty. So, short notes of uses of laser in surgery. What are the drawbacks? Misdirection. If you use your laser in misdirection, it can cause fire, gas embolism. It has occurred during laparoscopic surgery. Skin damage can occur, and most important, eye damage. So, what are the precautions? All operating team or staff must wear safety goggles. Remember, equally important, drapes should be wet. Dry material should not be used with the help of laser. Always it should be wet. So instruments should not be reflective. That means the rays should not be reflected to other side. They will act on the other side. So non-deflective, very important. The instruments are coated to avoid reflection. What is reflection? You want to operate at one side and the rays get reflected to other side. That must be avoided. There are signals and you must follow the signal. Ting, ting, ting. The moment signal is over, don't use it. That means your job is done. So whenever there is some major problem, you have to wash the area. So another different types of energy sources is like laser, it is a RFA. It is called as a radio frequency ablation. Nowadays very commonly used for varicose veins. The difference here is it is faster and it can coagulate a larger area. RFA used for piles, neurological pain ablation, spinal tumor ablation. Energy here is in megahertz. It is a sound energy. Radio frequency sound. Sound waves are used. And it is a pulse radio frequency energy which can grasp, coagulate, vaporize, resect and hemostasis. But with this, there is no charring or sticking of the tissue. So RFA is used with specific purpose and nowadays used very commonly in varicose veins. Another device, hydrojet device, which is by a pressure of water. It is mainly used for liver parenchyma and renal hilar dissection. There is no scar formation. You can coagulate vessel up to 3 mm. Floating ball, which is used for cutting and hydrostatic. Dissection blood. So just remember the names. Thunderbit, we already discussed. It is the latest one, very costly, fastest in its class, reliable 7 mm vessel sealing, precise dissection due to its fine jaw design itself. Available bipolar energy for hemostasis without cutting. Minimal thermal spread, minimum instrument exchange. And there is no fume or mist formed with the help of Thunderbit. Ultrasound dissector has been using mainly for a liver. Low frequency ultrasound energy is used to dissect solid organs. So it is for nephrectomy, splenectomy or liver pancreas. This ultrasound dissector. CUSA is Cavitron ultrasonic surgical aspirator. What we are doing here? Operating and aspirating everything at the same time. This is mainly used for carcinoma of the liver. Soft tissues are fragmented, washed and aspirated with the help of same instrument. That is a CUSA. ESWL, you must have heard about it many times. It is extracorporeal short wave lithotripsy. Here energy is produced by electromagnetic method. So acoustic short waves through water will fragment renal stone more commonly. Sometimes it can be used for gallstones. And here they are focused under the guidance of CR. So it is ESWL, again a different energy source. Cryosurgery is controlled cooling. It is also another energy source. It is a cooling. How is cooling done? Nitrous oxide minus 98, CO2 minus 60, liquid nitrogen minus 180, freon gas minus 190. But we are commonly using nitrous oxide because it is easy level. How does it act? It produces crystallization, dehydration, denaturation. Commonest indicator for cryosurgery is warts and skin lesions. Initially used for chronic cervicitis and chronic piles. It is a bloodless and painless, but the depth is not adequate. Major disadvantage why it is not commonly used, because infection is common and the discharge is continuous for 3 to 4 days. That is why we are not using. And the smell is very bad. I have done many surgeries and we have stopped. So it is not commonly used. So we have considered almost all the types of energy source. The uses: cryotherapy, whenever you are dissecting the destruction of tissue by cooling. Liquid nitrogen for liver tumor, nitrous oxide, even though it is hemostatic, freezing and defrosting is inadequate, so not commonly used. Photodynamic therapy only for systemic injection of agents, where laser light can be applied directly. That is a photodynamic therapy. Microwave ablation, this is again one of the energy. It is a microwave energy probe. Whenever applied over the target tissue, it creates alternating electric field energy, which is again converted to heat, and this is very commonly used for liver tumor ablation. And most important use is cardiac arrhythmias. Understand? So microwave ablation has got a particular use in malignancy of liver. So we have considered how the electrical energy is produced, how it is used, what are the drawbacks, and what are the precautions you have to take. We have also considered different types of bipolar energy sources like our harmonic scalpel, then ligashore. We have considered most advanced technique of a laser, light amplification of a amplified laser waves. Huh? This is laser. We have considered in short about all the necessary things we are doing today. So remember, for us today it is a Bowie's machine and laser is future. Thank you. Please try to remember all this in way of short. By the way, thank you. Good day. Thanks.